that. All right, good morning everyone. It's wonderful to be back with you all. So good morning Queensland, and good morning to all our Facebook Live listeners. So I want to give a few updates and then talk about our path forward and just give everybody an understanding about what's going to happen over the next fortnight. So I can advise that we've had 9 new cases overnight. 7 are locally acquired and linked to the Indooroopilly cluster. So that's all good news. Then we have 1 case on the Gold Coast that's under investigation. So Dr. Young will talk to you a little bit more about that in a moment. But we do have 1 new case in Cairns. Now, we are quite concerned about this. It's a taxi driver, and he has been infectious in the community for about 10 days, and he lives at Kanimbla. So I'll come back to that in a moment. So we have 148 active cases, 26,286 tests in the last 24 hours. So again, good testing results. And over 8,000 vaccines by Queensland Health in the past 24 hours. And Queensland Health has done now over 1 million vaccines. So that's absolutely fantastic. So look, can I just say that Queensland's done a mighty job, especially those 11 LGAs that have been in this lockdown situation. And can I thank the Deputy Premier, the Chief Health Officer, the Health Minister, the Treasurer, the Education Minister for all the hard work that's also been happening with these daily updates whilst I've been in hotel quarantine. So at the moment we have 11,177 people in home quarantine, and as we've been saying, these people are our first and last line of defence. It is absolutely crucial that if you are given a home quarantine direction order, you must follow that order. So you must stay at home. If you need supplies, we'll get the supplies to you. Now, I know it's tough. I've just done 14 days in hotel quarantine. It's a big ask, but you are keeping the community safe. So I thank you for that. Okay, so now what does that mean for the 11 LGAs? Okay, well, we've got some good news today for the 11 LGAs, and thank you for all the families, everyone who's been doing a great job. So the lockdown will end in those 11 LGAs, but some restrictions must stay in place for the next 2 weeks. So it'll end at 4 p.m. today, but we're not out of the woods. So I just want everyone to have a really good understanding that we are dealing with the Delta strain. It's highly, highly infectious, and I can tell you from my conversations in Tokyo with people from around the world, this strain is sweeping the world. So we need to make sure we are making some extra precautions, and I'll go through those with you. So for the next 14 days, one of the key areas is in relation to schools. So the schools will reopen, but we do know that with this outbreak, with the high school students, we are now going to make sure that all school staff are wearing masks, and that includes childhood staff as well. They're also going to be given priority for vaccination, so the Health Minister will go through that in a moment with you. Now, all high school students will be required to wear masks at school. Now, can I tell you, in other parts of the world, this is exactly what's happening. I know it's happening in South Australia, and from memory, I think Victoria also has done this. But for our high school students, I please need you to wear masks because you will be helping to keep the whole community safe. And this is because we've got the Delta strain, and until we can get to those 70 and 80% of vaccination rates, masks are absolutely critical. These masks are absolutely crucial because they are your protection against the Delta virus as well as getting the vaccine. Okay, so what it means for everybody else, so let me just run through this so everyone's clear. And this will be on our Facebook site, and I'm quite sure it'll also be distributed by the media as well, but we've done a roadmap, so it's going to be very clear for everyone. So you'll be able to have, this is for the 11 LGAs, up to 10 people in your homes. Okay, so that's including those who live there, and in public spaces. Now you are able to go and visit loved ones in hospital and aged care, but of course you can't do that if you are subject to a home quarantine order. Weddings and funerals, maximum 20 people. Businesses and venues, including places of worship, convention centres, retail, dining, gyms, hairdressers, beauty and personal care services, are allowed to operate with some restrictions. So we're going back to that 1 per 4 square metre rule, or 50% with ticketed and allocated seating. I have to advise that during these next 2 weeks, community sport will not be permitted. I know some people are going to find that difficult, but we have to do that to keep Queenslanders safe. Now, of course, these masks are really important, so Queenslanders, keep wearing these masks, especially in these 11 LGAs. If you are out walking by yourself or your household, you don't need to wear it, but at all other times you do need to wear it when you're in the workplace, when you're going to cafes and restaurants, except if you're seated. Now, I can tell you from experiences of what's happening overseas, if you get a big outbreak, there are perspex screens and you have to take your mask, or you can take your mask off to eat and drink and you can't speak. So this is what's happening around the world. We're not at that stage, we're at a much better stage, but it's actually going to rely on all of us to do the right thing. And I know that Queenslanders can absolutely do the right thing. Now also, if you're living in one of those 11 LGAs, please, you can travel within that LGA, but now's not the time to be travelling to regional Queensland, unless you are an essential worker. But please put off plans to visit family and friends in regional Queensland for the next 2 weeks. Okay, now I want to address the situation in Cairns. Just give me a moment. Okay. All right, so unfortunately, this discovery of a positive case in Cairns is something that we were not expecting. And we really need the residents of Cairns to come forward with any symptoms and get tested. Exactly what's been happening with the 11 LGAs. And down here, everyone has been doing a great job. Any symptoms, go and get tested. Now, this person has been infectious in the community for 10 days. That is of real concern. So from 4 p.m. today, for the next 3 days, Cairns and Yarrabah will go into a lockdown. So it's essentially the lockdown that the 11 LGAs went into, but they will be allowed to have up to 2 visitors to come and visit their homes. We need more testing in Cairns. I am very concerned. Dr. Young is very concerned. We need to get on top of this very, very quickly. The Treasurer has already spoken to me. We are going to be looking at a business support package. I'll be speaking with the Prime Minister. Hopefully he'll agree with my request to declare Cairns a hotspot. But I am very, very concerned about what's happening in Cairns. So for the next 3 days, the Cairns community, I know you can do this. I know it's going to be tough. But the next 3 days, I need you to stay at home, minimise your movements. Let's test as much as we possibly can, and then we can evaluate that over the next 3 days to see if there are any more cases out there. And of course, we'll be also working with this man's family and close contacts, and the exposure sites will be being put up. Okay, so that's the issue for Cairns and also to the 11 LGAs. Can I just say to everyone, I'm very proud of the work that everyone has done. This is incredible. I mean, when Queenslanders always do what we ask them to, and I thank you all for that. And it's because of your hard work we are in this situation today. But as we know with this Delta virus, we do expect that there will be more outbreaks into the future. So we'll be updating you as quickly as we possibly can and taking that decisive action. If you go hard and fast, and that's also been a decision of the National Cabinet, it's been my personal choice as well with Dr. Young, go hard and fast and get on top of these issues as quickly as we possibly can to minimise. I also want to reach out to New South Wales too, and what they're going through is extremely difficult, and our thoughts are with them at the moment as well, as I know that they battle to get on top of this virus. It's tough out there. It's tough. This virus is not going away. It's sweeping the world, and I just thank everyone for playing their part, and we will get through this together. So thank you, and I will hand over to Dr. Young.
Thank you, Premier. So an excellent result for South East Queensland, one I truly wasn't expecting. It's a fantastic response. To see 8 days in, after we had those very large numbers of early cases, to see it under control so beautifully is fantastic. So those 11 LGAs from 4 p.m. today, that lockdown requirement is removed, and there will be some restrictions in place, but you will be able to return a bit more to a normal semblance of life. That is fantastic. But please, of course, any symptoms, any at all, come forward and get tested immediately, because then we can manage things as quickly as possible and manage the virus immediately and minimise the need for a lockdown in the future. Now, I do have that one case down the Gold Coast, and I really and truly want to thank that family down there. They were just brilliant. They've been brilliant all the way along. So one member of that family came forward and got tested and got a positive result, but with a very high CT value, meaning not a lot of virus. So we repeated it and it was negative, and repeated it again, it was negative, but there was that initial positive. So we're waiting to get a whole genome sequence on it to see what it might be, and the family has worked with us every step of the way, and they're in isolation, and we've tested everyone else in that family multiple times and done serology. All of that's negatives, but we do have that positive result. So it is really, really important today that anyone down in the Gold Coast with any symptoms at all, please come forward and get tested so we can work out what has happened there and whether there has been any spread. That's absolutely critical. We know that the Gold Coast was always a risk. I was always worried because we had that second case who came up from overseas who was managed in that Gold Coast area. Plus, of course, we know there are those enormous, very close links between the Brisbane area where we've had all these other cases and the Gold Coast. So it's really important, anyone in the Gold Coast, any symptoms, come and get tested, and we can work all that through. But today, the Gold Coast, as part of those 11 LGAs, the lockdown requirements removed, but I do need you to immediately get tested. And thank you very much to that family that's continuing to work with us as we try and work out what that one positive result means. Then Cairns. So thank you very much to that gentleman in Cairns who works as a taxi driver who came forward and got tested on Friday afternoon, and we got that result late yesterday. I've always been a little bit worried about Cairns because we had the marine pilot there who was positive in the community. We haven't seen any other positives from that pilot, but yesterday morning I asked people in Cairns to please come out and get tested, and I asked people in Cairns again. It's really, really important. Any symptoms at all, don't second guess yourself. Any symptoms at all, just come forward and get tested. And the Hospital and Health Service has put in place additional hours for clinics, and they'll work with the community to make sure there's those testing facilities available. All of that is really important. This gentleman had been out in the community during his infectious period for 10 days, so there is a real risk this could already have spread, which is why from 4 p.m. today we need to go into lockdown. Initially for 3 days, and I hope that's all that's needed to work out what the risk is. But we all know that once the virus has got out, you can't put it back. So we've got to go really early. So I'm very grateful to the people of Cairns and Yarrabah who'll be going into lockdown from 4 p.m. today. One thing, as I don't have all of the other information at this stage, I think it's reasonable that people in that area have 2 visitors. But if you don't need to have visitors, don't. just work it through, stay at home, only leave for those really essential reasons, and we'll get on top of it quickly. So that's really important. Then the other thing is, please, could people get vaccinated? We've reached the 1 million mark in Queensland in terms of the number of vaccines Queensland Health has distributed, and 2.5 million across the state from GPs who are doing the most brilliant job vaccinating our community. But I need more. So anyone who's 60 years of age or older, or they've had their first dose of AstraZeneca, like I have. I'm getting my second dose on Tuesday. My GP fitted me in, which I'm very glad about. So please, if you've had one dose of AstraZeneca, go and get your second dose if it's been more than 8 weeks since your first dose. If you haven't had a dose of AstraZeneca and you are 60 years of age or older, now is the time. You must come forward and to protect yourself, because we know in Sydney that they've unfortunately had quite a few deaths there related to their recent outbreak, but people who've had 2 doses of AstraZeneca haven't died. So it's really important. If you're 60 years of age or over, come and get your second dose, like I am, or come and get your first dose if you haven't had one yet. Thank you.
Well, thanks, Premier, and it's wonderful to have you back here in person and a chance to say thank you for getting us to the Olympics as well. What we've achieved here in the southeast is something quite incredible. It looks like we may have been able to contain a Delta outbreak in just 8 days of lockdown, just 10 days from when the first case was notified. I want to thank everybody who did the right thing and stayed home. That is what has worked here, as well as everybody who went and got tested. I know how hard it has been, but we've achieved something quite incredible together. From 4 p.m, as we begin to move out of lockdown, it's critical that we go back to the habits we had before the lockdown. Social distancing, masks and QR codes is what will help avoid the risks of a further lockdown. We are extending masks into schools for the first time, and Grace and the education team have done a great job of sourcing masks for smaller faces, which will hopefully help for younger people to get used to wearing their masks. Can I advise residents, particularly in those inner western suburbs where there's lots of people who'll continue to be locked in their home under home quarantine directions, that both Woolworths and Coles now have delivery slots available. They are able now to deliver groceries. Woolworths and Coles have also advised that their stores and distribution centres in far north Queensland around and in Cairns are well stocked, and so there's no reason for anyone in Cairns to feel like they need to stockpile essential goods. They will be available and they will be able to go to their supermarkets during the 3-day lockdown.
Well done, Queensland. It's an exceptional outcome, all because of the great work of Queenslanders coming forward and getting tested and getting vaccinated. But we have to remember it was only 8 days ago that this started. And we also need to remember that from day one we've always talked about the 28-day cycle. So everyone needs to check the roadmap and understand there are still some restrictions to the number of people in your households and public gatherings. And also there will be 1 per 4 square metres at cafes and restaurants, and also our stadiums and allocated seating ticketed events will be down to 50%. So please look at the roadmap. The rules around masks, you must still wear your masks. Indoors and outdoors, unless you're with your household or alone, when you're out walking or exercising, but please wear the mask every opportunity you can, and where it is mandated, you are expected to wear it. We have heard some reports that on the Gold Coast, less people being compliant with mask wearing, and we really ask with this new possible case on the Gold Coast, it's more important than ever that everyone comply with the rules around mask wearing, social distancing and of course good hygiene. But testing, whether you are in Cairns or whether you are anywhere else in Queensland, every day you delay getting tested when you have symptoms, you are risking spreading the virus in the community and you are putting at risk more restrictions. So we need to make sure if you have any symptoms, no matter how mild, come and get tested on the first day, not day 3 or 5 when you're still unwell. Please get tested straight away. We will have extra testing set up in Cairns, and if I can talk to the people of Cairns and Yarrabah, we'll have the Cairns Hospital Fever Clinic open until 10 p.m. today for walk-ins. Portsmouth will be open. 1 lane is open now, and we'll get that up to 2 later today. Those will be taking bookings, so people are not waiting hours. If you book in, you'll know when to turn up for your tests. Rural hospitals, Yarrabah Fever Clinic is being activated as we speak, and we're also arranging additional support to go out to Yarrabah for walk-ins. Other rural areas that are being activated now is Atherton, Innisfail, Mossman and Mareeba. So please, if you are in the Cairns or Yarrabah area, or if you've been in these areas for the last few days, check the website regularly today and continuing over the next few days for exposure sites. So even though you're in lockdown, if you've been to one of these exposure sites, we want you to follow the advice around that. You need to talk to Queensland Health and they'll advise whether you should be getting tested straight away and how long you need to quarantine for. Also, we're talking with the private pathologists. We are arranging for QML to do a pop-up walk-in on the Esplanade and a drive-through at Waree. So we will keep updating that information of the times of those clinics and where they are, and whether they're walk-in, drive-throughs, or whether you need to book. But we want as many people coming forward in Cairns to get tested over the next few days. That way we'll know whether we can lift this lockdown in 3 days' time. On vaccinations, we have updated our booking and our site for you to register for vaccinations. So you'll now see that you can register for a vaccination if you are working in childcare or you are working in a school, if you are a fly-in or fly-out worker, or if you work in a distribution centre. The reason why we've chosen these particular groups on top of our normal 1B priority groups is we know when it comes to distribution centres, they are absolutely crucial to make sure that we can get food and groceries distributed across the state, and we have seen outbreaks in distribution centres interstate, so it's important that they're vaccinated. Our fly-in, fly-out workers, we know that our mine workers, we have seen transmission from them moving around the country, and of course we have seen the most recent outbreak in our schools. So we are prioritising these groups, and we ask you to go online, register your interest, and as we open up more sites and as we get more vaccine, we will be able to pull you in and invite you to do bookings. So we ask people to be patient, because it doesn't mean they'll all get in and be vaccinated this week, but by registering, it means that we can know that you're in the system and we can invite you to get a booking. I also remind people that general practitioners are being provided with about the same volume of Pfizer vaccine as Queensland Health is. So people can go to GPs also as part of the general population for their Pfizer if they're 40 plus, and of course if you are 60 plus, go to a GP or a pharmacy for your vaccine as well. If we keep getting tested, if we keep vaccinating, and if you follow the rules, including those amazing 11,000 people in home quarantine, we know it's going to be hard seeing everyone come out of lockdown and you still having to stay home, but you are absolute legends by doing so, because you are keeping us safe. It is lawful that you stay home, but of course we want to make sure that we support you in doing so. If you need any assistance whatsoever, contact 134 COVID or ask for friends or family or neighbours to get medicine or foods for you to make sure that you can stay home safely. Thank you.
So we did see a lot less movement yesterday in the lockdown area, which was really great. In the end, we intercepted 3,575 vehicles that we checked in that area. So that was the good news. So there were less people around. Unfortunately, for 67 people, they didn't abide by the lockdown rules, so they were issued with on-the-spot fines. So the message for everyone is please don't go early on this. The lockdown remains in place till 4 p.m. and then we move into a new set of restrictions. So obviously our planning today is to look at making sure tonight when people feel like they're free and they go out and about that they do abide by what those restrictions are. So please do make sure you know what they are. And on that point, I'm going to dwell on masks again. We handed out 307 masks yesterday in our community. There are still a lot of people out there that don't carry and wear masks. I am going to bang on about this endlessly. Please make sure you are wearing your masks and take them with you. And 11 of those people, having been given the opportunity to put on their masks, refused to do so, so 11 were issued on-the-spot fines. We did issue 119 penalty infringement notices across the board yesterday, most of which 106 related to people not abiding by the lockdown requirements. There were 2 arrests. One included the young woman who had escaped from hotel quarantine on the Gold Coast. She was located in Caboolture with the assistance of the community up there. We thanked them for that. They identified her and then kept track of her until our people were able to turn up and take her into custody where she remains, and she'll remain in our custody until she completes her quarantine and face other serious charges before the court. We dealt with 265 calls for service and happily we inspected 298 businesses and all were compliant. Thank you.
Dr. Young, is this the new model that you're pursuing where you get a single case in an LGA and move to snap lockdown that LGA on an individual basis?
It depends. So it really depends on what the risk is and how long I think I've got to assess that risk. Given that this gentleman has been in the community infectious for 10 days and given that he's had 2 positive tests, both with very low CT values, which means a lot of virus, I think the risk is reasonably high. He's also, I haven't got the results back yet, but a number of people in his household are unwell. So I just think I can't afford to wait to do any further risk assessment. I just need to immediately ask the Premier that I think we've got to lock down straight away, because if I were to wait another 24 hours, that's another 24 hours that there might have been people infectious also out and about. So this is try and contain it and get on top of it as quickly as possible. If we don't see any more cases, then we can reassess. Of course we can.
Should Queenslanders get used to this sort of in and out of lockdown for a month ahead till the end of the year?
Well, until we have a reasonable percentage of our population vaccinated, a National Cabinet has said that is about 70 to 80% of the population being vaccinated.
Dr. Young, Yarrabar's included in that snap lockdown. It is relatively close, but it is a remote community. Is the taxi driver thought to have gone to that location, or is it a precaution?
It's just because we know that people in Yarrabar really and truly work and move into Cairns. So although it's a remote First Nations community, it's very close. So that's why, just to protect them.
Dr. Young, can you give any updates on when people under 40 can expect to get their Pfizer vaccine?
At the moment, they really should be looking at getting Pfizer vaccine when it's available, but when it's available is really a decision for the Commonwealth, and I understand the Commonwealth is trying to access more doses.
Do you think people should then be going and getting AstraZeneca at this time if they can?
And they need to go and talk to their GP about what their personal risks are and find out what their GP advises them.
Are you still looking at that September deadline for under 40 being able to finally get the Pfizer vaccine?
As I
under 40 are frustrated and they can't.
Of course they're frustrated, I can fully understand that, but really it is up to when the Commonwealth is able to access increased doses so that we can distribute them. The second the Commonwealth provides us with that vaccine, we're ready to give it to everyone.
And in terms of prioritising teachers, vaccinations, etc., FIFO workers, distribution centres, are you opening up any mass vaccination hubs to deal with that, and how will they be prioritised?
Yes, so we're working all that through. We will make sure we have enough sites to use up every single dose of Pfizer that we get given as rapidly as possible. So we'll just work it through. Once we've got more Pfizer to give, we'll make sure we've got the delivery mechanisms to do it as quickly as possible.
And just to clarify on masks, you said high school students are wearing them. What about primary
No, not primary school students at this stage. We are doing some work with education who've been excellent, and they, as you saw, have sourced some smaller masks. So we will work through with education whether there are some older students in the older years that maybe they might start wearing masks. But we'll work it through. At this point in time, the advice around Australia is that children 12 years and older should wear masks, and we've just made that anyone in that older age group in the older schools from year 7 upwards, but I understand at this part of the year they'll all be 12 anyway. But if there were any 11-year-olds who are going to year 7 or older, we'd ask them to wear a mask as well.
This latest lockdown's obviously been the hardest, and you've explained why. Can you talk to us about what other levers you have in place if we ever did get into the situation where Sydney finds itself now, where we're not able to contain something in a short amount of time? What other levers might you have?
Well, I think we used them this time. So we had no visitors to the home. That's the first time we've ever done that. That was really ramping it up. And also, I think the compliance was so much better. So it's not really about us having more levers to pull. It's about people complying with the levers we've got. And people did comply. And you can see that.
When did the taxi driver first start getting symptoms, and did he delay getting tested?
Yeah, so he started getting symptoms 8 days ago. And he got tested on Friday night. I don't know. There's no epi-link so far that we're aware of. We really need the whole genome sequence, which I hope we'll get by tomorrow morning.
How will you restrict people travelling from Cairns back down into or outside of those areas, either by plane or car? Are you concerned that people will come out of that area back down into South East Queensland?
Well, that's why we've got the lockdown requirements in place.
Have you increased policing in that area? Or
I won't. Would you like to speak to the...
Sorry, Doctor, can I just clarify quickly? The 7 linked cases, they were all in isolation?
Yes.
Yep.
The interesting thing, though, and I'm so grateful to these families, is we're seeing more students still become positive. And that just shows that although Delta usually spreads more quickly, it still does have that full length of the incubation period. So we've got 4 related to Ironside, one of them a student, and 3 household contacts in different households. 2 related to Brisbane Boys Grammar, again another student, and then a close contact. And then another related to the Indooroopilly Karate School class, and that's a household contact. So I was a little bit surprised to still see students becoming positive. So these students had tested negative when they first went into quarantine and then have subsequently become positive. So that's why it's so critical that these 11,000 people don't think, oh, well, I'm coming towards the end of my incubation period, it's no longer a worry. It is. So it's absolutely critical that all of these people just remain in home quarantine until they complete the 14 days. The thing that I am concerned about for the well-being of these people is that as you get another positive case in the household, that means the quarantine for everyone else in that household starts again, another 14 days. So this is really tough for those people.
The community sport directive, does that apply to training sessions as well?
So I only want sport to happen within schools, in their school groups, because they've spent all day in the classroom together, so yes, they can continue sport. But for the next 2 weeks, given where we've seen this outbreak, it has been related to schools, I don't want community sport to go ahead that brings a whole lot of different people from different parts of Brisbane together, but I'm fine if it's within a school, if that makes sense. Yes, because in community sport you actually come close together, and we know that this virus can spread within seconds. So yeah, community sport I think is different. We've got to remember we're not dealing with the variant we dealt with a year ago. So the strategies we had in place a year ago won't work now. We've had to significantly ramp them up. That's why for the next 2 weeks it is important that people just check and don't think, oh, we're going back to what we were doing last year. We're not. The strategies have ramped up.
How many, have you got testing targets at camp like you have in the South East?
I'd like everyone who's got any symptoms to just come forward and get tested. Not a target, I just need people with symptoms to get tested.
Do we have the capacity to do this?
Yes, we've got plenty of capacity and we'll increase the capacity. And the private pathology sector have been working with us every step of the way since the start of this pandemic and have been absolutely brilliant. And yet again, we asked them and they've ramped up testing.
Can you tell us what sort of life Javi has been living for those 10 days long?
Yeah. Yep. So he worked as a taxi driver from the 31st of July through to the 4th of August. But that's relatively controlled because we can then work with the taxi agency to work out who was in his taxi cab. So we can work that through. He's also been out and about. He's been to the Brothers Leagues Club in Cairns, and we'll be putting up all of these venues on our website. So he has, of course, he's been out and about. He's been living his normal life.
Premier, can I just ask you, Victoria was quick to celebrate the end of their lockdown, and days later they have dozens of cases and new lockdown.
Yeah.
How comfortable are you with where the state's at, first of all, and then secondly, how comfortable should Queenslanders be of what lies ahead for the next few months?
Look, I think that's a really good question. I think, in terms of we are dealing with the world pandemic and we're seeing this Delta strain take hold in countries all around the world. We have to go on what the best advice is. That's from the Chief Health Officer about going hard and going fast. And, whilst today we should be very pleased that we're going into that next fortnight, I think Queenslanders should be under no illusion that we just don't know when the next outbreak is going to be. So that is why it is absolutely imperative to wear your mask. If you're sick, go and get tested. And when it's your turn, go and get vaccinated. This is absolutely critical. And I can assure you, from the National Cabinet meeting we had on Friday, every single state and territory is on board with this strategy. Every single state and territory and the Commonwealth.
Premier, how was it stay in quarantine? Do you sort of have an appreciation for how hard it is?
I have a great appreciation. I think, honestly, our staff are incredible. So from the moment you see the police give you your directions notice, the health staff also contact you whilst you're in quarantine to check on how you are going, which is fantastic. Remembering a lot of people may not have a lot of friends and family and would find it very confronting. And it's very important to keep in contact, I think, with people. So it was great also to get to see the nurses come to do the COVID tests. I mean, that's probably the only time I actually saw people during that time. I was very grateful, and look, our workers out there are doing an extraordinary job, and also to the hotel staff. It is great work, and thousands of people have gone through hotel quarantine like I have, and we have thousands of people going through home quarantine. It is absolutely important, and I was very pleased last night to be issued with my release forms.
Just similar question to Dr. Are you wanting to see the future in Queensland be over coming months of more this localised lockdown model rather than larger southeast or statewide, more individualised LGAs?
It just depends, and that's again a really good question, because we move around a lot as people and families and friends, and the interactions we have. People go right across our state. It's a big state, so we just have to take the advice as it comes. But until we get to that 70 and 80% vaccination, and I'll be talking more about vaccination over the next couple of days when we look at setting up a couple of big centres, because we really want to drive those vaccination rates up. And of course that's dependent on supply, and I do thank the federal government for bringing forward that 112,000 doses, and we want to get that out the door as quickly as possible. And like you've seen today, we've also prioritised our teachers, all of our school staff, our retail workers, our fly-in, fly-out workers to get their vaccinations as quickly as possible.
Government talking to the first time we had a standing
Sorry.
On Les Walker, you gave him a talking to the first time he had a bang at it, just got the second. Is another talking to enough? And does he embody the
I'm disappointed. He's disappointed in himself, but it's got to go through the court processes now, so I'm not going to talk about that publicly anymore.
Sorry, I just have a question about the
Oh, can I just also say one final thing? Sorry, and just in relation to the Olympics, the Lord Mayor and I will be talking about that on Tuesday. We agreed that the health issues were far more important today. I thank everyone for their support, but we'll go into more detail about that on Tuesday. I think people can appreciate that. Yeah, we'll be talking about that over the next couple of days. I'll give you an update tomorrow. Yep.
The lockdown there in particular for the adjoining Armidale LGA, you've spoken about this over the last couple of days. Is there any changes to restrictions for the water bubble? And secondly, you do get the test results, I think you said, in the morning for wastewater, particularly for Coffs Harbour. Has there been anything in the last 24 hours, and how up to date are those test results?
Thank you. Very important question. So Coffs Harbour has tested negative several times since we had that positive. So New South Wales is not concerned about Coffs Harbour at this point. Armidale, there was one individual who returned from university in Newcastle, where they've had quite a number of cases now, who went home and infected a household member. But at this stage, they haven't seen any other cases. I mean, I'll get more information when AHPPC meets at 1 o'clock today. But yesterday when I spoke with my colleague, they hadn't seen any more cases. But a bit like I've advised about Cairns, they went very early, very hard lockdown. So we'll just have to see what happens over the next few days. It has meant that I haven't felt that we need to change anything in that border zone, remembering that Armidale isn't in the border zone, it's south of it. So I'm reasonably comfortable that the border zone as it stands is safe at the moment, and we've been doing all of that work with New South Wales, and New South Wales has asked their residents who are in the border zone, if they come into Queensland, when they go back into the border zone in New South Wales, they need to stay at home for 14 days. Unless they're coming back into Queensland, because we're actually a higher risk to the border zone than the border zone is to us, although that risk has diminished significantly.
What will it take to tighten those restrictions? And secondly, are you worried about, there have been reports of people are going in and out. So there was someone who went to a Byron restaurant and allegedly went to a Queensland restaurant a number of days later and was cited in both those areas. This might have been pre-lockdown, I might add. Right. Are there concerns about that happening now that lockdown is lifted?
Right. When the lockdown is lifted, as I've said, our risk we've assessed as being substantially less. It will then be up to New South Wales what they do on their side of the border. But once our lockdown has lifted, people in Queensland can move across for essential reasons. So going to a restaurant would not normally be an essential reason.
The hard border will remain. The hard border will remain policed.
Of course it will, because there's major risks all through regional New South Wales. Indeed, Newcastle has become an area of great concern. Yesterday they'd had 11 cases or more associated with Newcastle, mainly associated with the university there. And that's led to the seeding in Armidale, so that's a risk. Then Bowral's a risk down in that area, Mudgee, Orange. So there's multiple areas through regional New South Wales that have become a risk, which is not surprising given their large numbers and their cluster now.
So just on sort of this mask, I'm sure parents will be asking, where do I get mine? Obviously, state schools are going to force them.
There's lots of masks. You can buy these masks everywhere now.
The schools have them.
Yeah.
The schools have got the supplies.
Yeah, there's plenty of masks. Yes, for the next 3 days, yes. Except, of course, for vulnerable children, and it's up to the principal to determine who a vulnerable child is. They know their children, and for the children of essential workers.
Speaking of travel around Queensland, obviously the Premier said now
That is very, very strong advice. And look where we've come recently with strong advice and people following it. So people need to just think about the reasons they need to do things. And that's what they've been doing so brilliantly in the last 8 days.
Is there concerns that people, say from Brisbane, might flood the Gold Coast or the Sunshine Coast as like a post-lockdown kind of holiday? Is there concerns there, or because we've all been part of this lockdown?
No, you can move within the 11 LGAs.
Yeah, that's fine.
Thank you.
Okay, thanks everyone.
Thank you.
Thank you.
Nobody wants Grace?
I do.
Everybody wants Grace.
There you go, Grace. Thank you, Premier.